Welcome. Today, we're diving into the world of ophthalmology to explore a condition called hemangioma, specifically focusing on capillary and cavernous types. We'll unravel what these vascular anomalies are, how they affect the eye and surrounding structures, and what treatment options are available. The exact cause of hemangiomas isn't always clear, but they're generally considered to be congenital, meaning they're present at birth, although they may not be immediately apparent. Genetic factors may play a role, and certain signaling pathways involved in blood vessel formation are thought to be disrupted, leading to the abnormal growth of blood vessels that characterizes hemangiomas. Let's talk about the underlying mechanisms. Capillary hemangiomas, sometimes called infantile hemangiomas when they occur in infancy, consist of tightly packed, rapidly proliferating endothelial cells. These are the cells that line blood vessels. These cells create a dense network of tiny capillaries. Cavernous hemangiomas, on the other hand, are made up of larger, dilated blood vessels resembling caverns or cavities filled with blood. The growth and eventual involution, or shrinking, of hemangiomas involves a complex interplay of growth factors and other signaling molecules. Angiogenesis, the formation of new blood vessels, plays a key role in their initial expansion. Hemangiomas, particularly infantile hemangiomas, are relatively common. They're estimated to affect around 4–5% of infants. While capillary hemangiomas are more prevalent in infancy, cavernous hemangiomas can present at any age. There are no significant disparities regarding race or ethnicity, but females tend to be affected more often than males. The signs and symptoms of a hemangioma near the eye will vary depending on the size, location, and type. A superficial capillary hemangioma might appear as a raised, bright red or purplish lesion on the skin. Cavernous hemangiomas located deeper may cause a bluish discoloration under the skin. If the hemangioma is pressing on the eye or optic nerve, it can lead to blurred vision, double vision, astigmatism, or even amblyopia, also known as lazy eye. In rare cases, large hemangiomas can cause proptosis, or bulging of the eye. Diagnosing a hemangioma typically involves a thorough clinical examination by an ophthalmologist or dermatologist. The doctor will assess the lesion's appearance, size, and location. Imaging studies, such as MRI or CT scans, may be used to evaluate the extent of the hemangioma and rule out other conditions. In some cases, a biopsy may be performed to confirm the diagnosis, but this is generally avoided unless the diagnosis is uncertain. While both are vascular tumors, capillary and cavernous hemangiomas differ significantly. Capillary hemangiomas are primarily superficial skin lesions comprising small, tightly packed blood vessels. They often grow rapidly then involute over time. Cavernous hemangiomas are deeper lesions made of large, dilated blood vessels that don't typically involute. They can occur in skin and internal organs, leading to more significant compression and complications depending on location. Treatment for hemangiomas depends on their size, location, and the presence of any complications. Many small hemangiomas will involute or shrink on their own over time and require no treatment. However, if the hemangioma is affecting vision, causing significant disfigurement, or leading to other complications, treatment may be necessary. Options include topical or systemic beta blockers like propranolol, corticosteroids, laser therapy, surgical excision, or a combination of these approaches. The specific treatment plan will be tailored to the individual patient's needs. Unfortunately, there isn't a definitive way to prevent hemangiomas, as they are generally considered to be congenital. However, early detection and management are crucial. If you notice any unusual skin lesions or changes in your child's vision, it's important to seek medical attention promptly. The prognosis for hemangiomas is generally good, particularly for those that involute spontaneously. However, some hemangiomas can cause lasting visual impairment if they're not treated promptly. Research is ongoing to better understand the underlying mechanisms of hemangioma formation and to develop more effective treatments. Recent advances include the use of beta blockers as a first-line treatment for infantile hemangiomas, which has significantly improved outcomes and reduced the need for more invasive procedures. Ongoing studies are investigating new drug targets and therapies to further optimize the management of these vascular lesions.